My name is Elvis Ngandu. I'm 36 years old. I'm from Zambia, Africa.
There would be times where he would try to make it seem like he was okay, but I could tell beyond the look that he would be in pain. Even my kids, they would feel bad seeing their dad when he was in pain. There was a doctor that we met who was able to tell partly what the problem was with him. He underwent an operation on 1st June 2009, I remember. And after that, he was okay for some time. But again, with time, the pain started coming back. We moved from hospital to hospital, trying to figure out exactly what it was.
No doctor that I could find in Zambia was willing to help me. Others would say it's adhesions, others would say stress, different things. But finally met someone in Ndola who connected me to Aklish, and now came to know about Wockhardt Hospital.
And then they were able to do paperwork for us. That's when they made all the possible arrangements, and we traveled to India and we came to Wockhardt Hospital.
And my first impression from the doctors was very strange in that they were able to give me time to explain what I had. They listened to me, and that was different because Dr. Mehdi was good, Dr. Patel, and after they did a lot of tests, they also discovered something else which was not picked up in Zambia, which they said was pancreatic divisum and intestinal malrotation. So it's like I was born with a lot of different complications, and I think that is what would confuse the doctors that I would meet.
But he used to get bouts of recurrent colicky pain. So we decided to investigate him, and the first thing, after all his biochemical markers, we did a CT abdomen pelvis, which showed us that he had a malrotation of his gut, and incidentally also they reported a pancreas divisum, and he underwent ERCP with a sphincterotomy, and he had a pancreatic stent inserted. And he was discharged from the hospital, happy man, 1 week later, and was asked to follow up after 3 months.
So after 2 days, I asked him, I was like, how are you feeling? And then he told me, you know what, I'm feeling okay. When he told me that, I kind of didn't believe, because I'm used to hearing him telling me that he's in pain. I was like, are you sure? Then he said, yeah, I feel better. Then after a week, he was like, you know what, I actually feel okay. And I was really, really happy. Dr. Mehdi is a doctor who worked on him. Even Dr. Patel, I must mention.
Anyway, long story short, they put in a stent to fix the pancreatic divisum. That was December last year. Went back to Zambia, and I still couldn't believe that I was okay. Came back this year to have it removed, and it's such a relief to wake up without the pains that would wake me up around 4-5 hours in the morning. I remember telling Dr. Mehdi that, as I feel nice that you have an idea of what I have, and I can, even if you don't touch me, don't do anything, at least I now know what you have, and that was big relief.
I can't thank you enough to all the Wockhardt staff for the work that they've done. I know.
As well as Aklish, who's been very, very supportive, Jiv, and the hospital as a whole. You're very professional. Please continue with the good works that you're doing. Not only are you helping the patients, but I'm sure you're helping families as well. Thank you very much.